Hey, my name is Jordan Hall. I'm a master's student at the University of West Alabama, and this is my video on joint mobilizations for the upper and lower extremity. Now we're going to do ankle joint mobs. So this will be the anterior direction that I'm about to show you. So I'm going to cup his calcaneus with my left hand, and I'll stabilize on the distal tibia, and I will just pull anteriorly. And this is for plantar flexion. And now I'm going to do the same thing, but for Then we're going to do the same thing, but this is the posterior joint mob. So this is for dorsiflexion, and I'm just going to push posteriorly. And you just kind of turn a little bit. All right, this is a lateral joint mob. Just same thing, cupping here at the distal tibia and moving laterally. This is for inversion, and then I will do the opposite and pull medially, and that's for eversion. Now we're going to do anterior and posterior joint mobilizations for the knee. So first we're going to do anterior. I'll stabilize the femur. We have him on this bolster here just so I have room to get underneath his knee. So stabilize femur, kind of like you're doing the Lockman, and I'll pull from behind the tibia, so pull in the anterior direction. And this increases extension. And now for posterior, we're going to do basically a posterior drawer. So I'll have thumbs on the tibial plateau, and I'll push in the posterior direction to increase flexion. Now we're going to do the joint mobs for the hip. So first we're going to do medial and lateral. So I'll have the patient's foot up on my shoulder, and I will bring them into somewhat of an inferior distraction. So I'll pull this way, and then for medial, I'll use this forearm to push, distract, push medially, and that will be to increase abduction. And then for lateral, we'll do the same thing, but use this forearm to push laterally. This increases adduction. So now we'll do an anterior to posterior mode. We're going to cross here. I'm going to come on this side, and I'm just going to go push in a straight line to increase external rotation and flexion. Now we're going to do joint mobs for the shoulder. We'll do anterior and posterior. The first one we're going to do is posterior though. So I'm going to cup his elbow here, kind of stabilizing against my body, and the table will stabilize the wrist. I'll use the palm of my hand on his proximal humerus to push posteriorly. And this increases internal rotation and flexion. So now I need you to flip over on your stomach. I like to do this prone. So I have him here, kind of resting on my knee. And I'll hold his elbow again here. So now I'm going to push anteriorly to increase external rotation and extension. Now we're going to do joint mobs for the elbow. So we'll do anterior and posterior. So I will have my hand on his distal humerus. I'm going to kind of cup him here in between my elbow and my waist. And I'm going to push anteriorly. And this increases flexion. And now I'm going to switch my hands and do posterior, which increases extension.